Continuing our talk with David Anderson, and your press releases, we have 3 of them. I don't know if we've got time for them all, but reminder to make sure you've got insurance when travelling off island, I suppose, is the one that's grabbed me here, because, again, people assume that they're covered, and that's not necessarily the case.
That's correct. I mean, there's been quite a high-profile one fairly recently in the press, which highlighted again that people, just because you go to the UK, doesn't mean you're covered for insurance being repatriated back to the island. We have an arrangement with the UK Health Service that treats anybody for emergency health care, but if there is a situation where that person needs to be repatriated back to Nobles Hospital maybe, they need an air ambulance. That can cost a significant amount of money. You know, you have medics travelling with you. It can cost up to 5 figures. It can cost £10,000. So people don't think just because I'm going to the UK for a holiday to stay with relatives, they'll actually need that. It could be an incident that happens when they're away. Yes, they think about it when they're going skiing in Europe. They take their insurance out because they know there's no insurance cover between the Isle of Man and the UK, and Europe. But when they're in the UK, they only have cover for emergency medical cover, so they need to have the repatriation. And it's quite a small investment for the risk that you take, really.
Well, you said there has been a high-profile case fairly recently. Have there been other ones? I mean, is this an ongoing problem that you're coming across?
Well, they're not regular, but when they happen, they cost the individual a lot of money. And we've had a couple of examples where the individuals haven't had that money, and the general public have been very generous in supporting those individuals, raising money to come home. But really, I think that those cases have highlighted the general public. They need to have this basic insurance in place. And there are local insurance companies can make sure that they've got that cover. It's something they can just add on to their policies.
And how are you doing without these millions of pounds a year that you were getting from the reciprocal health agreement?
Well, it works both ways, really. You know, the UK pay for the people to come, you know, if the other way round, if you like. If the UK resident comes to the Isle of Man, they have the same problems. We have to make them just as aware that their insurance needs to cover them as well as our residents being in the UK being covered the other way. So I'd like to use this opportunity to raise the profile of people actually coming on holiday here to make sure they have adequate insurance cover, because we're not part of the UK.
Okay, Ireland's acute mental health inpatient service charge, excellent.
Yeah, well, obviously the mental health services not long come back into the Department of Health when the different departments were moved around a few years ago. Mental health then sat in the Department of Social Care. It sits back in the mental health has come back into the Department of Health, and I think people recognise that it's the best place for it to sit, and we're delighted that they've been accredited at such a high standard. I recently visited very many of the different areas of mental health that are situated around the island, and I was very impressed by the professionalism and the dedication of the staff, and obviously this just confirms that. And the good thing about this is not just an outside agency that's come in with clipboard. It's actually people that actually are users of the service have verified that the Isle of Man has an excellent service in this area, and it could give great reassurance to the general public.
And a stroke nurse specialist has now been appointed at Nobles. There was one before, or?
Medicine is moving very fast in these sort of areas, and it's very useful now to have a specialist nurse in these different areas. These are people that have been trained to a significant level, working under the consultant, and you know, they are able to, as far as stroke is concerned, it's an area that they need to make sure the person gets the adequate medical intervention quickly. The quicker they get the intervention and the more professional it is, the greater chance they have of making a full recovery. And our stroke unit, I think, is first class, and the adoption of a nurse specialist in this area will certainly improve things, and any updates in medication can be followed through. This person won't rotate through the different wards. This person will be based solely in the stroke unit, and therefore working under the consultant, it gives more power to their elbow, if you like.
An added head count though?
We have created, actually, from within the resources for Nobles Hospital, they have managed to create this post. So it's not an extra post, it's just a rejigging, if you like, of the headcount at Nobles Hospital. We're delighted with the appointment, and we wish the lady very well. We think it's a very positive mood and will help the population in the Isle of Man feel that if they have a stroke on the Isle of Man, they'll have as good a chance as anywhere of making a recovery.
Finally, how are you enjoying health?
I'm enjoying health very much. My health is quite good at the moment.
Is this a good place to fall ill?
I believe it is. Obviously we have our challenges, but we have some very dedicated people. We're very lucky to have been able to appoint some really top consultants in recent years who are very dedicated. We have significant challenges because a lot of these people that come with specialisations now only do one specialisation, so that is a challenge for us. But we have access to the first-class tertiary centres in the northwest, and I hear on a daily basis people saying how happy they are with the level of professionalism they've received in their particular area.
Any shocks when the budget comes out, when you get your next year's budget?
I hope not.